then you can get funding. And you typically request funding for as long as it takes to complete your trial. So a few years usually. One can also obtain funding from private sources. So sometimes you can receive unrestricted funding from a private donor, from a hospital foundation, like we received at St. Michael's Hospital. Our foundation was incredibly generous with us, as was the foundation of St. Joseph's Hospital and other foundations from the hospitals involved in our trial. You can also get pharmaceutical company unrestricted funding, or you can get restricted funding where you're in fact collaborating with a pharmaceutical company. So the reason why it was so challenging for us in the middle of the pandemic is because one can imagine that there's probably no greater scientific stimulus than a global pandemic. That's obviously very upsetting and can be distressing, but can also, on the flip side, be very inspiring. If you're a researcher in a given area, the idea of being able to positively impact in the middle of a pandemic is an opportunity that most scientists will not want to pass up. So then that means that the number of proposals is just, exponentially higher than usual. So it means that you're competing with that many more other groups. And unfortunately, funding opportunities are finite. And so we submitted for a COVID research call, a competition, and there were over 300 submissions, 339 submissions for clinical trials. And 30 of them, the top 30 were funded, and we were ranked 31st. So our trial was thought of very highly.
Oh, boy.
Yeah. The feedback that we received was incredibly positive.
But you were 31st.
But we were 31st, so it didn't matter.
Oh.
Yeah.
So there's always a need for funding. I mean, one of the things I don't want to lose sight of is that this trial is ongoing and that funding is urgent and necessary. I remember talking to one of the doctors that said that they even had a GoFundMe page.
Yeah, we still do. It's the first time that our hospital foundation has done this. It's amazing. All of the firsts that have occurred in the middle of the pandemic, it's really remarkable. So they created a GoFundMe page for our trial. And that's the website that's listed on the podcast to encourage people to donate to our trial if they have the means.
I don't want to take away from the podcast, and I'm hoping that our listeners will take some time and go listen to them. But is there a takeaway? Is there something that you'd like to share that you hope that we remember from all of this work that you and your colleagues have done?
Maybe that I guess the takeaway that I would want to impress upon a listener is that our rapid trial team is a group of dedicated investigators and research teams around the world that have put their personal lives on hold, and in some ways, even some components of their professional lives on hold to make this trial fly in the face of extreme adversity. This is a team of people that have incredible strength, incredible generosity, ability, intelligence, and kindness. And that we couldn't do this work, of course, without patient trial participants. And so we talk a lot about the teams behind the trials, but if we didn't have patients signing up to be part of the clinical trials, then we would never know the answers to these important clinical questions. So I feel like it's our responsibility, and I know that that's how our entire team feels. It is our responsibility to honor the trial participants and to honor the spirit of true scientific research that is being done to try to help save people in the middle of this terrible time.
So Pillar of Hope is the podcast, and it can be found with a Google search on almost any podcasting platform. Are there other sources or links to information?
Yes, there's a link to our GoFundMe page, which is our St. Michael's Hospital Foundation COVID Rapid Hope. But if you Google my name, Mary Cushion's name, Peter Uni's name, and the Rapid Trial, there are links to all of the work that we have done thus far and to the work that we have published that is related to this thus far. And you can read about our other work too.
Is there something that we've missed or something that you wanted to talk about that we didn't?
Honestly, not much. We're just, it's literally now us sort of putting our heads down and just making it happen. Maybe the one thing worth mentioning is that our numbers in Canada are staggering.
Yeah.
Right now. And when one can not successfully recruit to a trial either because there aren't enough eligible participants, or in this case, potentially if the healthcare system is overwhelmed. And so that's been a concern at some sites, even though that they've got multiple patients that are potentially eligible. There's a buckling point, right? And we have to be sensitive to that. So, for example, we're going to be setting up a meeting where I'm going to speak with the Canadian sites and to talk about this, but I just feel very strongly that it's important to be incredibly sensitive. Can we talk about some of the difficulties? Or is there anything that we can do to support you? Because these are hard times, and we have to acknowledge that sometimes people just can't recruit because the entire system is completely overwhelmed. And even though we are, exchanging funding and et cetera with sites, it doesn't take away from, just having to be a sensitive human being, right? Like, you can't just throw money at problems. Like, it doesn't necessarily fix things, right? So maybe that's an important issue to highlight. And I think it's just really also speaks to kind of the heart of our trial and our approach. These are hard times, and we recognize that.
What are some of the most difficult conversations you have, and how do you work your way through them?
One of the hardest things to do is to listen and to put myself in that person's shoes and really to try to understand where they're coming from. So I would just say that, how do I navigate difficult conversations? I listen. When I hear something that might be offensive, or like offensive in any way, personally offensive to my values, perhaps offensive to the structure or the community or the hospital or patients or whatever, my first response is to repeat what they have said and to ask them if I've understood them correctly. Mm-hmm. So I've just heard you say,
Yeah, you reframe the question.
Mm-hmm. Say, did I understand you correctly? That is a game changer for me, because one of the things that I can classically do in a difficult conversation, this is like my entire life, personally, whatever, is you have a hard conversation. Somebody's sort of like, could be emotionally or verbally assaulting you or whatever. And I sit there in silence, and then I walk away. And 1 hour later, I realize, oh my God, I should have said this, or why didn't I stand up for myself, or why didn't, And so that has been a really important tool to have, just to repeat it right back to them, because it's also making me rethink it and acknowledge, okay, no, this is a weird thing to say. And also making sure that the speed with which I speak is as slow as possible, also to give myself that opportunity to react. Because sometimes my natural inclination, I don't know, this might be generalizable, I don't know, but is almost to rush through the difficult conversation. Like, let's just get to the end and let's just come to some resolution, even if it isn't really a true resolution. And I think also acknowledging that you don't have to fix everything in the first conversation, to sort of set up follow-up conversations, to ask the person to reflect upon certain things and for us to regroup. And it's okay to say, you've given me a lot to think about. I think I need some time to think about this further. And at that point, then, I'll set up another meeting. And I think that all these principles are sort of transferable to personal difficult conversations too. Another really sort of difficult conversation that I have is, when I have to tell somebody that they're really, really sick, or a family member that they're dying, somebody's dying, or that they're dead. That's an awful conversation to have. There was a psychiatrist that I worked with at McGill when I was doing my medical training. She's alive. She's so brilliant. And one of the things that she told me is that, when you're dealing with somebody who's palliative, or really, really sick, that it's important to sort of really validate their experience. And also never to say things like, I understand, unless you really have experienced that. Don't ever say that. And so I'm very careful to say, I can only imagine. Yeah. Because I've never lived in that person's shoes. And that's true, I guess, for a lot of difficult scenarios, but also to say, you're not alone. I'm here with you. We're here for you. And to say, sometimes it's too much to ask for a good day or a good hour or a good moment. But it's never too much to ask for a meaningful moment or a meaningful day. Mm. And that came from that psychiatrist that I worked with.
I like that.
Isn't that amazing?
Yeah, that is.
And that's what's so sad about all this, is that, at least as a physician, when I'm having difficult conversations, like, human touch is so healing.
Yeah. Yeah.
You know, like when I put my hand on somebody's shoulder and I say, we're here for you.
Yeah.
That is healing.
Okay. I really want to thank you for, again, taking time to share this story, because I think I think you and the team and the story are remarkable.
My pleasure. Thank you. Thanks for everything.
All right. Take care. And where'd the dog go?
He's asleep. He's a pug.
Okay.
They sleep like 23 hours a day.
Perfect. That's all right. All right. Thanks, Michelle.
Thanks. Take care.
Take care. Bye-bye. We've been speaking with Dr. Michelle Sholzberg, who's a clinical hematologist and the medical director of the coagulation laboratory at St. Michael's Hospital. She's also the lead researcher in the Rapid COVID Coag study. To find out more, just Google Rapid COVID Coag study. You can also help out by going to the GoFundMe page at St. Michael's Hospital. You can listen to the podcast, which is Pillar of Hope on Apple Podcast. And, of course, you can Google Michelle Sholzberg. That's another edition of the Conversation Lab. This radio program and podcast is produced by CFRO-FM in Vancouver's downtown east side. We're on the territories of the Squamish, Musqueam, and Tsleil-Waututh nations. Our gratitude and thanks to them, as well as to the many not-for-profit organizations, community groups, and change makers around the world that support this program. If you enjoyed today's conversation, please consider becoming a member of Coopradio to support this program and the many others produced by hundreds of volunteers. If you have a story to share or know someone who does, please have them contact us at coopradio.org, theconversationlab.ca, and on many social media and podcasting platforms. This episode was cobbled together with some help from Brian McKinnon, Kimit Sekon, John Massacar, and Julian Anton. Thanks, guys, and thank you for listening. I'm Don Schaefer.